It's time now for Voices of the Region, when we hear from an area journalist about stories making news. This week we talked with Marshall Helmberger, publisher of the Timberjay News and Tower.
So we're reporting this week on the financial relief, which is finally on the way for the nearly 500 laid-off Northshore mining workers after Governor Tim Walz signed that $10 million unemployment extension package on Wednesday. The bill provides 26 weeks of additional unemployment insurance for workers at the Babbitt Mine and the Silver Bay pellet processing facility. Their benefits had originally run out last November. Workers at the facilities were laid off in May of last year after Cliffs closed the facilities. The extended benefits are available for those who have used up their original 26-week benefits and are retroactive to when those benefits ran out. This will affect about 490 Northshore mining employees and 5 employees of Dyno Nobel, a mining explosives company, who are also expected to benefit. The workers have been in limbo since last May, when Cleveland-Cliffs idled both facilities in response to changing company needs and an ongoing dispute with the Mesabi Trust over royalty payments on ore extracted from the Babbitt mine. Now, in a compromise with Republicans, the company will pay an increased future amount into the state's unemployment fund based on the additional benefits provided in the bill. An original version would have exempted Cleveland-Cliffs from that additional tax. Now, based on prior statements by Cleveland-Cliffs, the earliest that Northshore workers could expect to return to work is April. However, Cliffs has already extended the shutdown once before, and company CEO Lourenco Goncalves has begun referring to the facility as a swing plant that will only be run occasionally as market demand requires. We've also been reporting recently on Ely's Nursing Home, the Boundary Waters Care Center, which is experiencing a severe cash flow crunch and is actually reaching out to the community looking for donations to see them through until later this year, when they anticipate an influx of state funds that could hopefully help resolve the situation. Nursing home director Adam Maslowski, however, is concerned that they may not survive to that point, which is why they've reached out to local news media and have sent out about 7,000 letters to area residents asking for cash, donations. They should have gotten some of that funding last year, but the legislature adjourned without reaching a deal on additional health and human services funding, so that's added to the problem. A number of factors have contributed as well, including more vacancies in terms of beds than usual, and that a lot of that is related to COVID. The severe worker shortage is also impacting the facility because it's forced them to use expensive traveling nurses to meet the staffing needs, and that's increased their payroll costs even as the number of residents has declined. We're also following a new study based on data that was gathered by the Environmental Protection Agency, in which they tested fish found or caught in lakes and rivers in the U.S., and they found that they contain dangerously high levels of toxic synthetic chemicals known as PFAS. That's acronym PFAS. It's short for perfluorooctane sulfonic acid, and that's part of a family of synthetic chemicals that are known to bring a wide range of health concerns. These PFAS and other closely related synthetics are widely known as forever chemicals. They're known to be persistent indefinitely in the environment. The chemicals appear to concentrate in fish tissue, among other places, and they've become increasingly common in the environment since their use in the production of firefighting foam and many other products became more commonplace beginning in the 1950s. EPA testing between 2013 and 2015 showed that even infrequent consumption of freshwater fish was linked to higher levels of these toxic chemicals in human blood. The median levels of the chemical detected in freshwater fish was 278 times higher than levels found in most commercially harvested fish. The study cites research that suggests levels of PFAS currently found in most humans may suppress the immune system. And additionally, exposure to PFAS has been associated with many other health harms, including an increased risk of cancer, high cholesterol, thyroid disease, and reproductive and developmental harms. The study also cites data that indicates those who regularly catch and eat fish had levels of these chemicals in their blood ranging from 9.5 to 27 times that of the general U.S. public, which should certainly be raising alarm bells here in Minnesota, where a significant percentage of the population regularly eats locally caught fish.